Have you ever wondered how pregnancy can affect a woman's sugar levels? Well, there's a term for it: gestational diabetes. This condition is essentially a rise in blood sugar levels that occurs in pregnant women who have never had diabetes before, but who have high glucose levels during pregnancy. Gestational diabetes is a bit of a mystery. It's like an unwelcome guest that pops in, usually around the 24th week of pregnancy. But the good news? It's temporary and typically subsides after childbirth. However, it's not a condition to be taken lightly. It can increase the mother's risk of developing type 2 diabetes in the future. It's like a red flag, a warning sign that the body isn't processing sugar as well as it should be. So you see, pregnancy can change a woman's body in unexpected ways, including her sugar levels. But what could happen if gestational diabetes isn't managed properly? Well, it's essential to understand that uncontrolled gestational diabetes can lead to several complications for both the mother and the baby. For the mother, there's an increased risk of high blood pressure during pregnancy, also known as preeclampsia. This condition can lead to serious, even fatal complications for both mother and baby if left untreated. Moreover, gestational diabetes can result in a larger than average baby, known as macrosomia. This could make vaginal delivery more challenging and increase the likelihood of a cesarean delivery. For the baby, aside from potential delivery difficulties, there's also a higher risk of obesity and type 2 diabetes later in life. Not to mention, the baby might experience low blood sugar or hyperglycemia shortly after birth, which can cause seizures if not treated swiftly. Therefore, managing gestational diabetes is crucial for both mother and baby's health. Now, you may be wondering, how can one know if they have gestational diabetes and what can be done about it? Well, let's delve into that. Diagnosing gestational diabetes typically involves a two-step process. The first step is a preliminary screening test, often referred to as the glucose challenge test. This involves drinking a sugary liquid and having your blood sugar levels checked an hour later. If your blood sugar is higher than normal, it doesn't necessarily mean you have gestational diabetes, but it does mean you'll need to take a more comprehensive glucose tolerance test. The glucose tolerance test is a bit more involved. After fasting overnight, you'll have your blood sugar levels checked. Then you'll drink another sugary drink, this one containing a higher level of glucose. Your blood sugar levels will then be checked every hour for 3 hours. If at least 2 of these readings come back higher than normal, you'll be diagnosed with gestational diabetes. Now, on to treatment. Managing gestational diabetes revolves around keeping your blood sugar levels under control. This often involves making changes to your diet, such as eating balanced meals, reducing your intake of sugary foods, and eating smaller portions more frequently. Regular exercise can also help to regulate your blood sugar. If these changes aren't enough, medication or insulin therapy may be necessary. Remember, early detection and proper management can make all the difference. Given all this information, is there a way to prevent gestational diabetes? I hear you ask. Indeed, there are steps you can take to significantly reduce your risk. One of the most effective ways is by maintaining a healthy weight. A balanced weight not only keeps you feeling fresh and energetic, but also reduces the chances of developing gestational diabetes. It's about finding the sweet spot between not gaining too much or too little during pregnancy. Next, let's consider your diet. A well-rounded diet, rich in fruits, vegetables, lean proteins, and whole grains, can work wonders. It's not just about eating the right things, but also about portion control. Too much of anything, even the good stuff, can tip the balance. Now on to exercise. Regular physical activity is the magic potion here. It helps control your weight and keeps your blood sugar levels in check. It can be as simple as a brisk walk around the block or a fun dance session in your living room. The key is consistency. But let's not forget about the importance of regular prenatal checkups. These visits are crucial for early detection and management of gestational diabetes. Your healthcare provider can guide you on the right path and provide personalized advice. In conclusion, gestational diabetes is manageable and temporary, but it requires awareness and precaution. Stay informed, stay healthy.